The name of the program is The Talk with Tariro. If you remember, the last 2 weeks we have been focusing on the issue of obstetric fistula. And if you remember, in the first episode, as well as even in the second episode with the medical doctor, they spoke about the issue of child marriages, how they make someone susceptible to obstetric fistula. So really, as a country, currently we are grappling with the issue of initially knowing as Memory Machaya, later on the law enforcement agencies digging deep into the issue only to discover the girl is actually Anna Machaya, who died while giving birth at the age of 15. So today we want to look at community perspectives on obstetric fistula, mainly focusing on the issues of child marriages. And we've brought back Rosalina. Rosalina Zerenke is with Amnesty International. She is the campaign's coordinator. We say welcome back to the talk, Ros.
Thank you so much, Tari. Thank you for having us back on your show.
What we want to find out, Rose, we know you spoke about the research that you did, and I'm sure by now people know about obstetric fistula. We unpacked it. But let's dig deep into the issue of child marriages. What were the voices saying about the issue of child marriages? How prevalent is it in our country?
Okay, thank you so much, Tari. Maybe from the voices of the communities, it is difficult to know the prevalence of child marriages because there's not enough research also that has been done to know the incidences of child marriages. But what I know is that Plan has carried out a research particularly in Manicaland on child marriages. And they say that our prevalence rate stands at 33-34%. And there is a very deep connection between child marriages and obstetric fistula, based also on the research that we carried out. When we were talking, like I said, we also managed to visit Mpilo Hospital. We managed to visit Chinoi Hospital and Mashoko, the two where the fistula camps happen. What we learned from the nurses, from the doctors, you know, who assist in carrying out these surgeries is that the greatest number of fistula patients is the age below 18. Girls who have been married off before they are mature enough to get into a union such as a marriage. And most of these girls belong to a certain apostolic sects where they are not allowed to seek medical services during and after pregnancy. So this is how deep the issues are, that, you know, a certain religious belief or a certain doctrine will not allow you to go to a hospital to get medical, and you have been married off at 13, at 11. We had a story, I'll call the girl Memory, for the purposes of protecting her identity. We interviewed this girl during a camp in Chinoi. She says that she got married at 12 to a 55-year-old man. And when she fell pregnant, she had to stay with the husband, and the delivery process was monitored by the Amwene.
At 12?
Yes, at 12. She was 12, the guy was 55. And the delivery had to be overseen by Amwene and some ladies from the church. And, the child died in the process. The child of the child died in the process, and she got a fistula. So she was operated during one of the fistula camps in Mashoko. So those are the horrendous stories of young girls who have been married off,
Yeah.
and the implications not only to maternal morbidity,
Yeah.
but to several other rights of that child
Yes.
that have been taken away at such a tender age, where you have to lose your own child as a child.
Yeah.
The trauma that comes with having to hide away from people because you are leaking urine at that tender age.
Yeah.
You know, your whole life is just at a standstill. Your whole life has just been taken away. All your rights have been
Yeah.
taken away. And at times in a very final way, like I said in the previous incident.
Yeah. How does this affect the complete social mental well-being of adolescent girls?
Well, you know, when we say girls, Tari,
Yeah.
we are saying girls who still want to go and play maumbwe.
Yes.
And so you find that when you are leaking urine, when you are married, which means one, you have actually self-stigma. You actually begin to stigmatize yourself. You begin to tell yourself that I can't go there, I can't be with these girls, I can't go to church, I can't go wherever it is, which means my freedom of movement has been curtailed, it has been limited. I am confined to a room.
Yeah.
And at times you find that the stigma does not only come from the person, it
Yeah.
also comes from the family. They start labeling them.
Yeah.
You know, I was talking to a colleague sometime when we were still carrying out the research. In her area, there is actually a place or a homestead called Pamawet. Pamawet, because they are young girls who have been married off at the age of 12 and they leak urine. Saka, they are known as, you know, you look at the stigma,
Yeah.
the ostracization, you know, the name calling, the labeling that comes with child marriages and resultantly in obstetric fistula.
Maybe as a final word from you before we move on to an organization, Shamari Manaskana, to discuss more with this. As a girl child, how do I claim back my dignity?
Wow. The girl child lives in a community.
Yeah.
You know, traditionally, mwanangari wemunhu wese Tari.
Yes.
As a community, we need to take responsibility to protect the girl child before anything else, because she's already vulnerable. She's a girl child, sometimes poor, sometimes she has not gone to school.
Yes.
And so you find that it is the role of parents, it is the role of communities, it is the role of churches, particularly churches, because clearly churches have become cauldrons of abuse, who speak against child abuse in public but sneak child marriages in private. So we believe that the first role, the first responsibility comes from the parents, the community at large. And then as an individual girl child, girls need to be empowered to know their rights. They need to know when this is now becoming abuse, sexually or any other form of abuse for that matter. So they need to be told, Kuti, when you are being held in a certain way that makes you uncomfortable, know that you are already experiencing some kind of sexual abuse. You need to run away with your life and you need to report. It is okay to report. Do not suffer in silence. There's so many organizations out there. There's so many members of the community that can assist in terms of ensuring that if a girl faces any form of abuse that can result in a marriage, child marriage in courts, they should report such incidences. Yeah.
Indeed, as a young girl, do not suffer in silence. We continue with our discussion after the break. We continue with our discussion where we are looking at community perspectives on obstetric fistula. And now we are joined by Shamwari Mwanaskana, represented by Rudo Magwanyata. Rudo, welcome to the talk.
Thank you for having me, Tariro.
Yes, would want to find out from you the work that you are doing with communities addressing the issue of child marriages. We've heard that child marriages actually contribute to obstetric fistula because of that's just the general makeup of the girl child. They wouldn't have grown. So what are you doing as an intervention in the communities to curb child marriages?
What we have done, or what we are doing as Sangwari Manaskana, is to involve everyone. We are a community-based organization, so we are basically working with community members. We have CDCs, our community cadres, who work with girls directly in areas of operation. They conduct under scanner where we have girls come through to learn about their rights, to know their sexual and reproductive health rights, to know where to get help in the event that they need healthcare or law enforcement help. We have also managed to rope in men and boys. We have realized that men are the heads of the families.
Yes.
They are the ones who make decisions. So they have to know what rights do their children have, especially the girl child. They have also to be the spokesmen in our communities, because people actually respect men because of their patriarchy position. So if men and boys are able to speak up against child marriages and all other forms of abuse, we are able to alleviate child marriages in our communities. We have also engaged with traditional leaders in rural areas. We have had traditional leaders committing to putting an end to child marriages in their areas. So that is one of the milestones that we have achieved as Sangwari Mwanaskana as far as child marriages are concerned, in alleviating them.
Yeah, but how prevalent are they at community level? What are the cases that you are witnessing?
To date, from January this year to July, we have received more than 100 cases of child marriages. We have come to the conclusion that with the lockdown coming into play,
Yes.
it has also contributed. We have poverty striking many families. Breadwinners are not working. Most of our parents are informal workers. So with the borders closing and everything closing down, we've realized that they have settled into many of their children to better off families or a provider, so that they can be able to provide for them as children and their families. So the lockdown has really contributed to child marriages.
Yeah, witnessing almost like 100 cases of adolescent girls being married off. Who are the perpetrators? Who is marrying off? Is it the parents? Are they? I'm really trying to understand, because 100 for me is actually shocking in one community. And this is not nationwide.
As is in our 3 districts.
In the 3 districts only,
Yes.
100 girls married off. So what is happening at community level to put a stop to something like this?
From the cases that we have received, we have also noted that teenage pregnancies are quite a contributor, because according to our social norms,
Yes.
if a girl child gets pregnant, she elopes. So that's another contributing factor. It's already a child marriage there in play. So with child marriages in play and eloping in play, we have also realized that there's need for access to sexual and reproductive health rights. They don't have access to those. They don't know ways of contraceptives. They don't know family planning. And with girls experimenting with their boyfriends, it's also contributing to child marriages. So this is one of the things that we have realized, that as a nation and as an organization, we need to work towards access to sexual and reproductive health rights.
When it comes to issues of access to sexual and reproductive health rights, even services, young people accessing those services, there's always often arguments, particularly with parents, where we are then saying, at what age would I want my child to be accessing, maybe, say, family planning pills? And looking at the ages that you are witnessing child pregnancies, and then the lack of access that you are speaking to.
Most of the girls that are falling pregnant are aged between 13 and 14. So I would like to believe that the most adequate age would be between 12 and 13. However, with the assistance of a social worker assessing the situation,
Yes.
to see if the child is actually mature enough to receive the information, to receive the services. So between 12, 13 and 14, I think that's the average age that girls can actually access services and information.
Our health services ready? Do we here have youth-friendly health services that are at the mess of the children?
No, they are not ready. You find that in local clinics, especially in the urban areas, the high-density areas,
Yes.
the clinics are not user-friendly. You have nurses who are rude, who are judgmental. There is stigmatization there. So as a girl, I can't go there to get help.
Yeah.
I'd rather seek to backdoor services and get the help that I need. So we need user-friendly, youth-friendly services in our clinics and hospitals.
And when we have witnessed these cases where you have somebody who was pregnant at 13, pregnant at 14, at community level, what are you doing to make sure the perpetrators are brought to book?
What we have been doing as Shangwade Manaskana through our girls and support services, we have been trying to remove the child from this environment where she's a child bride. We have also worked with community members in alerting law enforcement agents. However, our biggest challenge is that once we go and report, there is no law in place to actually enforce the arrest to happen. So you find that the police actually say, we can't arrest him because there is no law. And then we are back to square one.
What
with
do you
the
mean
case.
there is no law?
There haven't been any legislation that actually illegalizes child marriages. We have the marriage bill that is still on the table that says the minimum age of marriage is 18.
Yeah.
However, it hasn't been passed into law. So without that law in play, the police and us cannot do anything to make sure that the perpetrators are brought to book.
So is that taken then as a marriage when it's rape, from what you are witnessing at community level?
It's not marriage. It's rape.
Yeah.
It's sexual exploitation of children. Because you cannot, as an adult, have sex with an underage girl who doesn't have consent. So where is the consent there to actually marry someone? There is no marriage there. It's actually rape. There's no consent. The girl child has no understanding of what she's getting into. There's lack of education and maturity to understand the implications and consequences. Therefore, it can't be a marriage with a minor. It's rape.
The discussion continues after the break. Welcome back. We continue with our discussion. So, Rudo, when you have witnessed that at community level, what role are traditional leaders playing in addressing this challenge in their communities? And is there anything that's happening to me, maybe as a parent, marrying off my daughter?
From our work with traditional leaders, they've actually resorted to kuripisa munhu kana achinzi paitika nyaya yechild marriage. So the parents and the perpetrators vanotouya kwasabhuku and the case is heard before sabhuku and voripiswa. And some traditional leaders have vouched to not to have any form of child marriage in their areas. There will be some consequences there involved.
Yeah.
So this is actually a milestone in as far as reaching out in rural areas and remote areas for us.
Yeah, we were talking about the issue of obstetric fistula in our last 2 episodes. And from what you are seeing at community level, how has these child marriages contributed to the problem of obstetric fistula?
We have also realized that lack of sexual and reproductive health rights, education is quite a contributor to.
Yeah.
So we have actually established hubs with information and services. We have had on-wheels campaigns with local clinics so that they can access help, be it maternal care for pregnant girls.
Yes.
They can actually go to clinics and with us there to access services. So it is a milestone for us in that the girls have been comfortable enough to come out with us being present through our on-wheels campaigns to access maternal prenatal care.
Do you have any cases of adolescent girls who were married off that would then say, we have helped them and they actually walked out of those purported marriages?
Yes, we have girls that have actually walked out. We have girls that have assisted in going to school. We also have girls that have been reunited with their parents. They've gone back home. They're actually
reunited when the parent is the one that initially married them off. What happens there?
We intervene through our psychosocial support. We encourage reunification of families. So through that work, we have managed to address families together and enlighten them on the dangers of child marriages, how children would benefit by coming back home and not staying in those marriages.
And when you look at it broadly, maybe through your interventions, could you share with us some of your success stories?
One of our success stories is of Lisa, who was in a child marriage. She was facing domestic violence from her partner then. So she came to us through a friend. That's when she approached our offices. We managed to talk to her through our GPSS department. And then what we do at GPSS is that when you approach us, we actually ask you what you want to do personally.
Yeah.
And then she told us that she wanted to go back home. She wanted to go back to school. So we approached the family. It was a very tough situation for us because for us as organizations, we are taught that we promote immorality. So to actually break through and be able to get that peaceful environment where we can talk to the parents and the daughter around, it was quite hectic. However, we achieved that and she went back home. She went back to her O-level studies. Right now, she finished her course in manicure and pedicure. She is actually doing something with her life.
And working with communities, you spoke about some chiefs who are making people pay vachiripa if they have indulged in child marriages. Have you had or are you having any community maybe interventions where we are working with communities starting from the grassroots going up, where you sort of run maybe campaigns to try and address this problem?
Yes, we do. We have had campaigns in Murewa, which is one of our operational areas. We have had campaigns in Chiwota, where we have involved our CDC members in the traditional leaders and the local community members through on-use campaigns.
Yes.
We have also done empowerment centers where we have community involved in our empowerment activities. Therefore, it drives our people away from resorting to child marriages. So this is the work that we have done at Chamwari Manaskana.
Yeah. What I would want to then find out is the issue of then saying, looking at maybe the law enforcement agencies, any cases that you would say maybe this is what we have seen, somebody who has been taken to court, something that can be deterrent to other would-be offenders that you have maybe experienced through, though you have said legally we still have challenges in terms of having a law, but definitely I'm taking it there are some who might have actually gone and recourse being sought.
I would say there have been some couple of cases where we've actually achieved something. Looking back in several years ago, we had the case of Nzira Maswaba, who was quite known for abusing women and girls in his church. I believe if you go back to those where we were strict with laws, whereby church leaders, apostolic sect, be it apostolic sect or the traditional churches, or any perpetrator in community could actually be sentenced to a stricter sentence and set as an example that this is actually not okay in society. We need to go back to those grassroots where our law is actually tough and harsh on perpetrators.
Yeah. So how are you mobilizing maybe service providers, policy makers to make sure that at least this problem is addressed?
We have had engagements with them. We have had workshops. We have had, through our advocacy work, we do online campaigns. We call on government to act on certain issues that we actually get from the grassroots, from the work that we do. So I believe with working with them together and with our cause for justice, with our cause for laws to be more tougher, for new laws to be put in place, we have actually done something as Sangwari Manaskana.
I recently heard about the issue of the call mainly coming from CSOs in terms of mandatory testing, mandatory sentence for issues of rape, which for me, child marriages falls into that. What is your stance on that?
Child marriages definitely falls into mandatory sentencing. If you realize that our law does not have mandatory sentencing. So I believe if we have a minimum sentence, it will be okay. It is actually a win for us to say the judgment is not based on the discretion of the judge. It's actually there that if you are found guilty of child marriages, you've got 10 years, which is actually good.
What's your parting shot, your final message?
My final message is that we need to work together in ending child marriages. We need to speak out. Communities need to talk. We do not have to turn a blind eye and say, just because red cup are next door, but we need to work together. We are one people. You are your sister's keeper, your neighbor's keeper. So to end child marriages, it needs all of us to speak in one voice.
Indeed, we need to speak in one voice. Child marriages is one issue that's actually even being addressed at African Union level. As a continent, it's something that's worrying us, and we heard how it contributes to obstetric fistula. So you and I have a role to make sure that we eliminate child marriages in our country, in our communities. You are your sister's keeper. Until next week, it's goodbye.